We are back on Morning Line. Thanks for joining us. Our guest this morning is Mary Moore. She's with Get Covered Tennessee, and she's among those who's in a position to help those of you looking to get health insurance through the Affordable Care Act. Open enrollment underway until December 15th.
Yep.
After December 15th, it closes, and you're stuck with what you have, which is fine, or nothing at all if you choose not to. And we were talking during the break. One aspect of this that had some controversy attached to it was if you choose not to get any health insurance or enroll, there could be a penalty. Those apparently, including last year, have been gone. You're not penalized for now. Now, why someone doesn't seek to get insurance still is a little bit beyond me. They're gambling that they're going to stay healthy, and then if they get sick, they're going to have massive bills where they could have had coverage, and it's just, well, what it is not smart. And I understand there's some people, though, that have issues with the premium, right?
So, you know, for most people, the subsidies are very, very helpful in lowering costs.
Okay.
There are some people whose income is maybe a little more middle income, or on the higher end of middle income, and there is a limit. So once your income is 4 times the poverty line for your household size, you're no longer eligible for any subsidies. So then you're looking at paying full cost on the marketplace.
Okay, which would be the same as if you didn't go on the marketplace and you just went to State Farm and said, I want to buy a policy. So the key is the subsidies. And all right, so I don't even know what it depends on. You're talking about an individual. For a family, let's say family of 4, where are the different thresholds for getting these subsidies in terms of income? I don't know if you know that off the top of your head. But
I can definitely give estimates.
Okay, all right, just to give people an idea.
Exact,
if it's a family of 4 and they're self-employed and they're making a certain amount of money and they want to get coverage for their family, how does it work out?
So the poverty level for a household of 4 is around $20,000 a year, a little over $20,000 a year.
Okay.
And then so 4 times that would be around 80,000.
Okay, so once you get to about 80,000, that's where, which, look, family of 4, 80,000, you can live on that. I think we'd all agree on that. You're not poor if you're making 80 grand for family of 4. You're not rich either, but at that point, the subsidies go away. Okay, but if you're making anything under that, you may qualify for some. If you're making, now, 20,000 for a family of 4, that's poverty, all right? And you would probably, what
Your
kind of
plan
subsidy?
could be 0.
That you could literally get it for free.
Yeah, with no deductible.
It's a big dang deal for those folks, especially
Definitely.
for children.
Very,
in that
very,
situation.
very helpful. So the children in that income range would qualify for free insurance through the state.
Okay.
But then and this is a population that we like to outreach to a lot, because sometimes parents are like, as long as my kids are covered, I'm fine. You know, their kid is their #1 priority.
Sure.
So they think my child's on TennCare or Cover Kids, that's great, I'm fine, I'll be okay. And they don't worry about themselves. But your child needs you, and they need you to be healthy.
Sure.
And a lot of people in that situation, maybe the parents' income is just a little too high for TennCare or Cover Kids. They should really check out the marketplace. It could be a great way to get their entire family covered.
Yeah. And the children will still free, but then you'd have some for yourself.
Exactly.
And you're so right. I mean, I understand the sentiment, my child comes first. But if you get sick and can't help the child, that's not helping your child. You know. So let's go to Smiley. Smiley, good morning. Hi, Smiley.
Good morning.
Good morning.
All right. I have a question. Of course, I'm already on a senior health plan myself.
Yeah.
But I was wondering if there was a page that I could go on my smartphone, because I don't have a computer anymore, but maybe on my smartphone I could go. Do they have a rating page that you could go to check different health plans on? Like, in other words, this company is rated 1 star, this company is rated 5 star, and you know, I'm obviously looking for a better deal, as we all are, but I was just wondering if there was some place that I could go to find out different ratings of different companies. Is that possible?
Okay. And again, that's not what you guys necessarily do. You don't rate. But and again, he says he's on a separate, probably Medicare type thing. I'm just wondering. That's what everyone wants, whether they call you or otherwise. They're going to want to find something that's best for them. Are you familiar with anything along those lines?
I'm not, unfortunately. And some of the same insurance companies that offer Medicare Advantage plans also offer plans on the marketplace.
Right.
So there's some crossover there, but I don't know of any.
There are so many
rating.
supplement plans, and I know for a fact there's ways you can go about. I can't tell you a website per se for that, but I even think there's organizations, if nothing more, AARP or something like that may have recommendations for different supplement plans for you that maybe, I don't know if it's whether you say one's better than the other or whether one's better suited for your needs, right?
That's what I was going to say, is that a lot of times people ask the navigators or ask us, I don't know, insurance is really complicated, there's a lot of plans, what's the best one? Which one should I pick? And we're actually not permitted to pick a plan for someone, so we're all about just helping people to make informed decisions.
So when someone says that, and by the way, we will put up the number and all the information on how you contact these navigators. But so if someone says that, I'm guessing what you would say back is, okay, well, maybe you'd explain, we don't make recommendations because I'm not working for any specific company, but tell me what you need. What are your conditions? And they may list down the 3 or 4 different pills they take and the different health conditions they have. And then you can look at that and then you can call up the screen and you can start looking at which plans match up, right? Now that's kind of recommending based only on which one's suited to them, right?
We can help them, you're right, think about what's important to them and then help them find out that information. So if it's a certain prescription, we can show them how to look on the formulary of each plan.
To see, is that prescription offered?
To see, and what the tier is, and how much the copay would be. And then the same thing with deductibles and networks is a really big thing for people who are in the middle of treatments. Staying with the same doctor would be really, really important. And sometimes once we filter the plans for that doctor, it's pretty evident, it's easier for them to make a decision.
And when they look at costs, and I was going to ask you to try to give me some averages, but so like a lot of plans, like my one here, okay, you have a situation where at Channel 5 I've got my insurance and you have a premium that you pay every month. And then when you go to get your medical care, you have a deductible. And until you meet that deductible, you're paying out of your own pocket pretty much. And the higher the premium you pay, the lower that deductible is. If you're healthy, like knock on wood my family is, I go for the lowest premium, okay, but I've got like a $6,000 deductible. So I kind of pretend when I go to my doctor and they say, well, give me your insurance card, I'll give it to you. I go, but I'm paying out of pocket right now until I reach $6 grand. And knock on wood, we have not even come close to that in the last few years. But I'm still paying money out of my pocket. Right?
Exactly.
I'm basically paying the premium to protect me should something catastrophic happen right now. That's what I'm doing.
That's a trend that we've seen with the marketplace plans as well. Now, a lot of folks qualify for what are called cost-sharing reductions, which are applied to the silver level plans, and they lower the deductible and the out-of-pocket cost.
Okay.
So a plan that may normally have a $5,000 or $6,000 deductible, depending on your income, may have no deductible.
But you're going to pay a higher premium then?
No.
No.
If your income is in that range,
that's right,
you'll get the lower premium and the lower cost sharing.
Okay, that's great.
So that's very, very helpful. Now, some people like to look at the bronze plans. Those are the least expensive plans on the marketplace, and they'll do kind of like what you're saying. Maybe choose a plan that has a lower premium but a higher deductible. Some folks could even qualify for a free bronze plan, and I like to point that out when people are really on the fence about signing up, especially these young invincibles, which I don't know if I'm still a young invincible.
Are you still young and invincible? I think so.
I don't know.
Okay. All right.
So in the past, I did identify with that population, but so I don't know if I'm still there. If somebody's really considering, am I going to get insurance or not? I say, look, if they have a $0 bronze plan that's available to them, why not?
And what would that provide for?
And they may still have a $5,000 deductible, but at least they have something.
So that zero, deductible, or the zero cost bronze plan would be there with a high deductible should they fall and suffer a compound fracture that's going to cost them $100,000 to have surgery and fixed. They're still going to have to find a way to shell out $6 grand over a period of time, but then maybe they'll have coverage for the rest of that.
Exactly.
And that's a gamble, but it's worth it.
And having the insurance is very helpful because if there was a situation like this, at least you can get treatment. And usually, you can get a doctor or a hospital to work with you on the rest, set up a payment plan. Like you said, they know they are going to get a payment from the insurance company. It's much easier than trying to go and navigate the system without any insurance.
Oh, yeah. Okay. I would say, and most of these plans, as they're offered, do they have no-cost preventative care?
All of the plans do.
Okay, then that's like most insurance, okay? And that's kind of neat. And what that means basically would be 1 or 2 physicals a year, maybe? Would they cover flu shots, things like that?
It's 1 physical, flu shots.
For women, preventative
for
things,
women,
like
they
pap
get
smears, things like that?
Exactly. So pap smears are no longer every single year because the recommendations changed.
Yeah.
But they are covered
or mammograms,
as they're
preventative stuff.
Mammograms over a certain age. Colonoscopies over a certain age.
Over a certain age.
Preventive things.
Just preventative covered straight up. All right, so that's pretty cool. So they cover for the preventative care, and then I guess people just have to decide what's best for themselves.
Exactly. Some of the insurance carriers they're all focusing more on preventive health now.
Yeah, sure.
And a lot of them are focusing on telehealth, which is pretty cool. So most of the plans have like free telehealth. So even if you haven't met your deductible, if you have a smartphone and you have their app, you can talk to a doctor, get a prescription refilled. That doctor can kind of ask you some questions and screen. Do you really need to go to the emergency room? Could they just call you in a prescription? You know, that kind of thing.
So it's like they're on call and they've got a little closed circuit TV camera in there ready to hook up.
And they can look at you with the camera on the
say,
smartphone.
I got this rash.
I mean, it's the wave of the future.
You're not kidding. I've heard about this. It's coming around. They're wheeling people in. You're in the emergency room sometimes, and there's a doctor coming in on a TV screen wheeled in to look at. Now, I don't know if I like. I'd much rather have them in person. But for what you just described,
could be useful.
Heck yeah.
So a lot of them are offering that either free or with a low copay, just to kind of entice people to use that more.
So you get in touch with these. That's pretty cool. All right, listen, we'll take a break. We've got more folks waiting on call here. Carol, Ann, and others, stay where you are. We'll get to your phone calls. Talking about open enrollment. It did start on November 1st until December 15th. So you got time. See if there's a better plan for you if you're on it. And if it's not you and you know someone who is, tell them they got to get on the ball. They may be able to find themselves a savings of some money. We'll be back right after this.
Storm 5.